Hey everyone, now I know I promised to do my next video in regards to the different types of surgery, complications and all that, but it turns out I ran out of time before I actually had my surgery. So I'm just going to share a little bit about my experience of what happened. I'm actually inside St. Mary's Hospital, part of the Mayo Clinic campus right now, and I am not even 24 hours after surgery. Surgery was a little bit delayed before I got in, but the whole procedure actually took about 5 to 6 hours. I went back into the OR around 1:30 p.m. and I got into my room around 7:30 p.m. in the evening. That's going in, getting anesthesia, including recovery room time and all that. What they did do is that they removed my first rib, and then they kind of opened up the scalene muscles and they noticed that there was a significant amount of scar tissue. So they helped to clean up all of that, and they checked all the blood vessels. They made sure that I didn't have a pneumothorax. That means that they didn't puncture the lung and the lung was deflating. Everything was fine. And they did a chest x-ray to confirm all that. So I was back in my room by about 7:30. I do have a drain near the incision, so they call it JP drain, and basically it lets all of the blood and the serous fluid kind of drain out from the area so it doesn't stay inside and make risk of infection. Pain actually hasn't been too bad. They are surprised that I am not using a PCA pump, which is that patient controlled anesthetic analgesia pump. I don't, where you press a button and you get pain medication. I haven't had to do any of that. They've basically been giving me Toradol shots, or ketorolac. It's like an anti-inflammatory, every 6 hours. I have been getting some shots of heparin just to prevent any blood clots, and been doing some oral Tylenol along with my other prescription medications. It wasn't until maybe 10 a.m. no, around 11 a.m. today that I actually had to use an oxycodone tablet, 5 milligrams, and that seems to have calmed down the pain. Last night I did have to use like a fentanyl in the IV for me to get a little bit more relief, but really, in general, my pain has been on a scale of 1 to 10 of 4, and then the more that I get up and walk, it was maybe going up to a 6. But the pain, surprisingly, is very manageable right now, and they decided that I'm going to stay inside the hospital probably for one more day because I am still draining a good amount of liquid in the JP drain, and they will most likely take out my drain tomorrow, and then I'll be able to leave the hospital after that. I know that I'll be staying in the area before I travel back home, because I have to fly back home. But so far so good. I probably won't give any more updates until I am back at home and recovering, because traveling and doing these videos would be very, very hard. But I will make sure to keep up with my recovery process and also physical therapy afterward. And hopefully I can give you some more updates as they come.